Good afternoon, and thank you all for joining us for this COVID update. I'm joined today by Dr. Bill Berman from the Denver Public Health. I asked Dr. Berman to join us because he is an infectious disease expert and professor of medicine. His knowledge about the various COVID-19 vaccines is extensive, and he's been an important partner to all of us. We're back in the month of March. Sometimes it doesn't feel like we got out of last March, but this week marks the one-year anniversary since the first confirmed case of COVID-19 in Colorado. Over the past 12 months, nearly 60,000 Denver residents have contracted this virus. Nearly 4,000 have been hospitalized over this period of time. As of today, we have lost 517 friends, family members, and loved ones in Denver to COVID. This has been a year like no other in our city's history. Every day has presented challenges, but as we come to a point in the calendar that calls us to look back, it is only appropriate to reflect on all we've lost. To mark this solemn anniversary, next week we will be lighting the tower of the City and County Building white to show our respect and honor the memories of those who have died. The following week, the week of March 15, the building will be lit red and white to honor our first responders and essential workers. And then, the week of March 22nd, the building will be lit yellow to symbolize the hope we all share for the end of this pandemic and our journey from rescue to recovery. And with this show of lights, we also acknowledge that the light at the end of this long tunnel keeps getting brighter and brighter every day. We are not ready to abandon caution or common sense, but we have some good news to share today. Our 5-star certified businesses are now able to open under level blue limits, which is providing them a little relief from the economic toll this pandemic has cost. We also have 9 of our library branches reopening beginning Tuesday, and we hope to have our city recreation centers open in the near future as well. The availability of vaccines and the more coherent and coordinated federal strategy are making progress possible that we are seeing today. As we all know by now, the Johnson & Johnson vaccine has received emergency use authorization from FDA. And President Biden believes we'll have enough vaccines available for all adults in the U.S. by the end of May. That is a phenomenal set of news and will go a long way toward putting this pandemic in the rear-view mirror. Approval of a third vaccine by Johnson & Johnson is, quite frankly, a game changer. And as the governor said, Colorado is receiving 45,000 Johnson & Johnson doses this week, and we're going to do our part here in Denver to get our shots into the people's arms as quickly as possible. We'll be partnering with the Aurora campus, COVID Check Colorado, and Denver Health to set up a vaccination event this Sunday on the campus for faculty there and residents in the surrounding area and under-vaccinated zip codes. COVID Check and Denver Health will be doing targeted outreach to these communities to get folks registered. So be on the lookout. And we're also pleased to tell you that the Denver Sheriff Department just received approval from the state to work with Denver Health to begin vaccinating eligible individuals incarcerated in the Denver jails. We're also opening the dates, or we have opening dates for our next 3 fixed community vaccination clinics. The clinic at Bear Valley Library will open Sunday, March 7th. The MLK Recreation Center Clinic will open Tuesday, March 9th. And the Barnum Recreation Center Clinic will open Wednesday, March the 10th. To help schedule appointments for residents in these communities, alongside our community partners who are doing grassroots outreach, we've set up an additional way eligible residents in these communities can schedule an appointment, which is giving us a call. Let me say the number, 720-865-3005. Again, that number is 720-865-3005. Now, we're doing everything we can to ensure equitable access to the still limited amount of vaccines, particularly in our African American and Latino communities. That's the goal of our city-based sites. I'm going to ask that if you live outside of these communities, Please help us keep these appointments available to those in these neighborhoods by using one of the other options available to you. If you've had the opportunity to check out one of our virtual vaccine panels and town halls we've held over the last several weeks, and we will be re-airing our senior panel tonight on social media channels, you will see the importance of reaching these underserved communities, especially right now as more and more vaccine becomes available. As you can see, we've had a lot of good news over the last week, and we should all have a little optimism that this pandemic is coming to a close in the months ahead. However, that doesn't mean that we can let up. In fact, protective measures have never been more important to keep our numbers low, because this isn't the time to spike the football and do a little end zone dance. We're not there yet. I'm going to say it again. We're not there yet. Please keep wearing your mask, keep social distancing, and keep washing your hands. The end is most certainly in sight, but we can't, like the Cleveland Browns did in 1988 at the 1-yard line as they got ready to cross the goal line here in Denver, we can't fumble the ball now. Thank you. And now I'm going to turn it over to Dr. Bill Berman, our Director of Denver Public Health, to provide more information on vaccines. Dr. Berman?
Thank you very much, Mayor Hancock. It is a time for both remembrance and celebration. I want to take just a few minutes to talk about the 3 vaccines that we're privileged to have, the Pfizer, the Moderna, and now the J&J vaccine. This first slide just makes a couple of points. In the second column there are the numbers of persons who were involved. And you can see these were very large clinical trials with 30 to more than 40,000 participants in each trial. I'll also say that there was a great effort made in these trials to enroll a diverse group of participants. Diverse in race, ethnicity, as shown on this slide, diverse in ages, diverse in medical conditions. Substantial proportions of persons had underlying medical illnesses. So I think those are 2 things that should give us a lot of comfort in evaluating their results. So on the next slide is shown those key outcomes. I want to focus just for a second on the column called sites. That's where the participants were enrolled. And you can see that there's a particular difference I want to point out with the J&J vaccine, that it enrolled both at a time and in places, South Africa and Brazil, in which some of these variant strains were circulating. In fact, in South Africa, the variant strains represented almost all of the strains currently circulating in those communities. And that's important when we evaluate the outcomes. I'd focus next on the column called severe COVID, because I think that's what we care the most about. That's individuals who are hospitalized, put into an intensive care unit, even died. And the point there is these vaccines look quite comparable when you look at that critical outcome of hospitalization or death. Importantly, the Janssen or J&J vaccine looks better and better with additional time for the vaccine to have its protective effect. And then lastly, I just focus on the asymptomatic disease. Those results are just starting to come out, and it's the best way that we can evaluate the potential impact of these vaccines on transmission of COVID to others. And so again, the news is good. There's only very preliminary data available from the Pfizer vaccine, and it appears that it decreases asymptomatic COVID infection and hence the risk of transmission. We have actually quantitative data from Moderna that after just 1 dose of vaccine, there was a 2/3 reduction in the risk of asymptomatic COVID. And then importantly, for the J&J vaccine, there was a 74% reduction in apparent asymptomatic infection and hence risk of transmission. So I think all told, these are 3 exciting vaccines that, as the mayor said, can really change the game with COVID. This is an exciting time for our community. Let's get vaccinated.
Thank you, Dr. Berman. We'll go ahead and open it up for question and answer right now.
Alrighty. We can start with Meg from the Denver Post. You have a question? Meg?
Meg,
Alrighty, do you have a
Yes,
question?
can you hear me?
Yep.
Yes. Hello. I wanted to ask, you said about the Denver sheriff had just gotten permission to work with Denver Health to vaccinate inmates in the jail. And my understanding, though, listening to the state, was that people were supposed to be vaccinated as their age group came up. Is there a reason why the jail inmates haven't been included until now?
Yes, Dr. Berman, you want to answer that question?
Yes, thank you. We've been working on getting those inmates included as appropriate for their age for some time. It's been particularly challenging with the 2 vaccines we've had. The Pfizer's vaccine requires this ultra cold storage, which is only available really in hospitals. The Moderna vaccine has the challenge of once you open the vial, you have to use 11 doses in 6 hours. And so I think this new vaccine will make it so much easier for us to vaccinate age appropriate and now medical condition appropriate persons at the Denver County Jail.
All right,
Thank you.
next question, Esteban.
Great question.
Hi, it's kind of a two-part question, but it's both for the mayor and Dr. Berman. I was curious what you think of the Rockies getting state approval to allow 25% capacity at Coors Field, and was the city consulted at all about this decision, or was this something the team did they go directly to the state for permission to get this variance?
We have remained in consultation with the state and the Rockies as part of this process. And as you know, the normal procedures is they submit through the county, which is Denver, and we would forward to the state. In this case, we have been in regular communication. It probably was done all at one time, quite honestly. But I got to tell you, you know what? It is important that we are thoughtful and allow the science to lead us in terms of our opening, which we have been committed to here in Colorado and certainly here in Denver, and to open up in a thoughtful manner with the right protocols in place. And so we know that sometime while the Rockies are playing between now and October, and we will see even greater opportunities due to the vaccination process that's in place. So I think it's appropriate that we see the Colorado Rockies open up a little bit with fans in the stands. Dr. Berman, you have a comment on that?
Yeah, only to say that I think it is quite reasonable, and it's just a reminder that the basics work. Masking as a single intervention decreases transmission of COVID by 80%. That's the equivalent of a vaccination. And distancing works as well. And so if we do the basics right, it's entirely appropriate.
All right, Vinny.
Yeah, hello, this is Vinny Delgiudice at Bloomberg News in Denver. On COVID and the economy, Mayor, what are the short-term prospects for unemployment in Denver? Thank you very much.
Well, obviously, thank you, Vinny, for the great question. The short-term prospects, obviously, this has all been about getting the economy back up and running and doing it in a thoughtful manner. Again, allowing the science to lead us where we want to go. That's why I made the point to slow down and to be very deliberate in my point. This is not the time to turn back now. If we see another spike or surge, it's only going to prolong the challenges, the economic challenges of people who are unemployed right now. We're close, and so we have to do what I love to say, and that is run through the tape with everything that we have, following the proper procedures with these masks, washing our hands, and social distancing. If we do those things along with the 3 vaccines that are in the marketplace, I think we have real good prospects, that we'll be able to turn this economy around very soon. Let me just remind everyone, Denver has been forecasted as one of the top cities that will emerge fastest out of the doldrums of this economic slowdown due to the pandemic. We still expect that, but we got to be smart about continue to handle what we have to handle with regards to this pandemic and run through the tape so we can get everyone back to work as quickly as possible.
John.
Mayor Hancock, John Frank here from Access Denver. Governor Polis mentioned earlier this week that he expects people not to be wearing masks at grocery stores come this summer. Do you expect to lift the mask mandate or have the state lift their mask mandate by summer, by June, or could we expect that even earlier?
Hey, listen, we'll continue to do, and I'll say it for the third time, follow the science. we continue to do what we have to do. As I've always said, and I think this aligns with what the governor said, I've always said the end of the summer, early fall is when I think we're going to turn the corner on this thing. So the vaccines are lining up, the timing for folks getting vaccines lining up well. We keep doing what we have to do, then yeah, I suspect that sometime this summer we'll see kind of the loosening, if you will, of some of the mandates related to the pandemic.
Seth with the Gazette.
Thanks. Mayor Hancock, just a quick question. Have you had a conversation yet with people from the White House about the letter that you had sent? I know they had gotten back to you about it, but has it progressed any further than that?
I need you to repeat the question. I didn't really hear you.
The letter that you sent to the president.
Oh, about having control of the vaccines, having greater local control of vaccines? Yeah, no.
Yeah, if you had actually had a conversation about it yet.
No, we haven't had direct conversation. We did get word that it doesn't look likely that they're going to change anything in terms of the protocols at this time. That was between the last time I talked to you all last week and now. But we are also working to set up a time where we can learn more about what they're looking at, what they're thinking. But I got to tell you, and I said it earlier, this is a game changer to have Johnson & Johnson in the marketplace. And with the number of vaccines that we are scheduled to receive in Colorado and in Denver, that's a big deal for us. And so we are working with the governor. He understands we're setting up these permanent sites. He wants to be a partner, and he wants to make sure we have what we need necessary to execute those sites. And to me, that's the thing that I wanted all along. And if we're able to do that, then that would be important.
Is there anyone we didn't get to? Or any follow-up questions?
All right.
Yeah, I had a follow-up question.
Go ahead.
Mayor, do you have an update on the FEMA reimbursement for the city? Does that continue to be a struggle?
Yeah, we are in regular communication with FEMA officials now, as well as the White House and our congressional delegation. We did get some positive news that, yes, it's moving, and Denver should be receiving its reimbursement very soon. And we're pleased and grateful to FEMA and all the folks, including Vice President Kamala Harris and our congressional delegation that really came to cities like Denver's defense and said, we got to move this along. These cities need their reimbursement. So we're grateful to them, and as well as to our FEMA partners who are beginning to execute on our request for reimbursement. Okay? Thank you all. Thank you, Dr. Berman.
In this how 911 calls are being handled. So the first issue I have is